let's talk about today. We put a working group together to look at hair salons, to look at barbershops, day spas, nail salons. And we have today their report, which we are making public, providing the best practices as these professionals start back in. We have set the date of May 15th, week from tomorrow, and I'm sure that that's good news for a lot of people who've been looking to get back, particularly in regard to their hair. I know I've heard a lot about that. And so, again, I just want to thank the working group. We had barbers, we had hairstylists, we had people from all over the state of Ohio who helped us do this, who wrote these recommendations, who came up with the best practices. And so I'm going to, at this point, ask the chair, Deborah Penzone, and ask her if she can Skype in here. Eric, we'll see if we have her on here. And I'm going to have her give a little report about, kind of who they had on their group and what things really they recommended, what will be really different as we look to the future as they go back in. And it looks like Eric is having trouble pulling her up. All right, I will move on then. And we'll get back to Deborah in a moment. Let me talk about restaurants and bars. I want to thank the group. Trevor Weaver headed that group up. We'll hear from her in a moment. Both of these areas, restaurants and bars, are already significantly regulated, highly regulated by the state of Ohio. The same is true in regard to hair salons, barbershops, very, very much regulated. So we start with that. In regard to the restaurants and bars, they're certainly regulated in regard to the Ohio food standards. The group that was put together included people who run restaurants, cafes, diners, everything from a very small diner in rural Ohio to a chain of restaurants. And so we had a lot of different people weighing in, coming up with the best practices. We have set the dates for them to come back, beginning for outside dining on May 15th, and inside dining on May 21. So that's May 15th, outside dining, May 21, inside dining. We do anybody by Skype yet? Eric. How you doing?
Hi, fine, Governor. Thank you.
Thanks for joining us. You want to tell us a little bit about your group and kind of who you pulled together and, kind of what will be different when customers come in and what maybe will be different for the employees and the folks who are in charge. Just kind of tell us how this will look a little different.
Absolutely. Thank you. It was certainly my pleasure to lead this talented group. As you said, we had a wide variety of folks on the team, and we also had representatives from the health department. And it was really an amazingly collaborative effort. And I felt like the differences, while on the surface could look like they could be challenging, they actually strengthened the recommendation that we put together for you. And it was certainly, like I said, my privilege to lead them. You asked if I could share a few examples of maybe what the customers will experience as we reopen Ohio, our bars and restaurants. Let's start with space. So restaurants and bars are going to be asked to create a floor plan that it complies with current social distancing guidelines. For example, under the current mandate, there are parties of 10 or less that would be seated together, and then each party is then going to be separated by either 6 feet or a physical barrier. So rather than having a hard and fast percentage like some states are doing, our advisory board actually focused on safety, not necessarily a specific number. So what do we mean by physical barrier? That could be fine dining, for example. You could have a high booth back that's almost like a wall. Or in some locations, they're using plexiglass that's being installed to separate. So we wanted to give each owner an opportunity to comply with those constraints within their unique space. What about waiting areas? You might be asked to wait in your car for either seating or maybe food pickup, or there might be a designated area now for queuing. And we would ask customers to just comply with those guidelines and be sensitive to those guidelines. A buffet bar or a salad bar will now be served to you rather than self-service. And there'll also be some 6 feet guidelines that are placed in those queuing lines as well. Entryways, for example, customers are going to see at the entryway when they come in, there's going to be a list of COVID-19 symptoms, and we're asking the public to self-monitor and ensure compliance before they come in. Employees was also one of the areas that we tackled. And so as you're entering and experiencing these restaurants, understand that while employees will be required to wear masks in certain positions, there are exemptions that will, for the restaurant industry, mostly apply to back of house. But if you see employees not wearing masks, understand these are for safety risks. One simple example is you don't want someone standing over a hot grill wearing a mask. So just understand that these restaurants are complying, but there are some exceptions that will be listed. And you, as a customer, as a guest, you might be asked to wear a mask. That's going to be at the discretion of the owners, and we would ask that you would respect those decisions. Another thing that you might see are gloves. This is an interesting topic. I know the gloves, it kind of makes everybody feel like Superman. They can touch anything, and it gives this false sense of protection. And I know the viewing public sees that, and there's a lot of concern around it. But there are very clear guidelines in food safety code that already exist today. And we as a team are returning. Our recommendation is to return to those guidelines. In many cases, we all ask our staff, put gloves on everybody, even though we know that's not necessarily best practice. Hand washing is and will continue to be the gold standard. And therefore, our committee is recommending that we follow those guidelines. So you are likely not going to see gloves on your cashiers or on your servers. One other area, Governor, that when we talked about this idea of open congregate space. So open congregate area will remain closed during this first phase, and we'll monitor our compliance as we go through this. But you could certainly repurpose that. So if you have a dance floor or other activity space, you can use that to be able to maintain that 6-foot distance of your tables. So that's why we didn't want to put a 50% of fire code compliance in place, because you might be able to keep all of your tables because of some of this open area and still maintain social distancing guidelines. So that's an example of how you could use that space. But I know we can do this. As you said, we can do two things at once. And I know we can do this. We can focus on safety and getting our restaurants reopened. So let's work through this together. We're asking everyone to don your masks. Please be respectful of the associates. They are doing the best they can. We're Buckeyes. I know we can do this, Ohio. Thank you, Governor, and I can certainly answer any questions that you might have.
Yeah, Trevor, thank you very, very much. Thanks for chairing the group. You had quite a cross-section of Ohio on there. I don't know if you want to comment about that or how that impacted it. But
Yeah, we did. It was really amazing. We had, in fact, on Thursday night when I was given the list, I plotted it because I just wanted to know who the folks were that I was, being asked to lead. And I was really happy to see we had, a lot in Cleveland, Southern Ohio, Cincinnati, Dayton, Akron, and then we had some of the more rural areas, Columbus, and we had big brands, big national brands, and the public can certainly see that was a press release. So everyone that participated, you can find that press release with the full gamut of those that participated. We had fine dining, we had pizza, Italian, we had a yogurt stand, we had a tap room, quick serve, several of our national brands, family dining. So it was really a group that worked together, and then they self-identified. So we had the 3 groups: customers, employees, and space, and then they each got to identify which area they felt most compelled to help lead the discussion. And then it was done across teams. They worked very hard. In fact, one of our team members said it was one of the most intense projects he's ever worked on. So for all of those in the industry, I was certainly proud to lead this group. They worked very hard all weekend long to put the best recommendations forward. And Governor, we appreciated the guidance you gave us, which was you wanted to hear from us best practices, that you didn't plan to override our decisions. It was our decisions to bring forward to you those recommendations. And so we felt very empowered to do that.
Thanks, Trevor. One last question. Talk to us a moment about bars. Bars present a unique challenge. Depends on how the layout of the bar is. What did you all come up with specifically in regard to bars?
Yeah, thank you for that. So, there was one consideration, and I know many states have done this. In fact, I think most did. They separated bars and restaurants, and we chose not to do that. What we wanted to focus on was the physical space and the constraints to maintain social distancing guidelines. So, for example, if you're a bar with tables and with chairs, you can follow these guidelines. So why should you not be permitted to participate in phase one, where and it can't be about the alcohol because restaurants are serving alcohol. So we're not making a distinction between a bar and a restaurant. What we're making a distinction on is physical space. If you have tables and chairs and can comply with these guidelines, then you can participate. Really for that open congregate area, and we understand we would have loved to have been able to include everyone in this phase one, but we needed to take it through these steps. And so that open space, if you want to put in picnic tables or folding tables, you can comply. But it really is about that physical space and being able to make sure that we can monitor and have kind of discrete floor plans. And that's just hard to do with open congregate area. I hope that answers your question.
Thank you very much. We appreciate it. Thanks to you and to everybody on the group. We're very, very grateful for what you've done.
Thank you, Governor.
Thank you. We will now go to hair and look forward to seeing Debbie Penzone. Will be coming up here in just a moment. John, I don't know if you want to say, as we're waiting, if you want to go ahead, anything you want to add? Oh, you're there. Okay.
We have Debbie right there.
Hey, Debbie. Thanks for joining us. We appreciate it.
Thank you.
You want to give us a little report how your group worked and what you came up with?
Yeah, Governor, I was very honored to be a chair of the Personal Service Committee and serve our great state, as well as I'm a licensed cosmetologist and hairstylist for 33 years. And our group of 30 in our committee was just amazing. It was very diverse. So we had the, one operator barber to the one operator stylist. We had the booth renting salons represented, as well as salons and spas of all sizes. We also had nail salons, tanning, and massage. And then we also had the 3 health commissioners that were on each and every call with us, guiding us with their knowledge. So I was very proud of us coming together as an industry and uniting because, just like the restaurants, there's so many different mom and pop shops or franchises or big salons, small salons. But we all do the same exact service when it comes down to it, when it boils down to that personal service. And that was at the core of our, working focus of our group, was really how to deliver that personal service from the client to the professional and the safest manner, and be able to be so inclusive of every type of business in our industry. So I was very proud of that, to work with them.
What's going to be different when someone goes in, has their hair done, goes to a barbershop? What are they going to feel different? I mean, what are they going to see differently, or what's going to be different, and what's going to be different from what the person who's serving them is doing?
Well, for the appointments, you might have to wait in your car until your appointment is ready. We'll also ask that the walk-in appointment or the appointment, that's the only person that enters into that facility, unless it is a child, of course, and the parent needs to come, or if they need a caregiver with them. And if they have a lobby or a waiting area, you're going to see the markings or social distancing there. You won't see the magazines or product testing or self-serve beverages out in the waiting areas. And we'll be donning, our professionals will be donning the mask and really asking that the clients and customers come with their face covering or their mask, especially with our services being so personal and so close, delivering that service to that guest. And some facilities and some locations might have, it mandatory that you wear that mask or face covering when you get your service done. We'll be cleaning a lot in between each and every guest. So the sanitation right now, we are governed by the Ohio State Board of Cosmetology and Barbering Board. So we do a lot of sanitation and take a lot of classes and online education all the time. So of course, we're going to go above and beyond with that as well to keep everyone safe and make sure that we're ready for that customer.
Well, that's great. Thank you very, very much to you and for your group for doing this. We're very, very, very grateful. Appreciate
Thank
it.
you.
Thanks for the good report.
Thank you. We're
Thank you.
proud.
Just a few thoughts as we take a couple big steps today, or at least announce when we're going to take these steps as far as opening up the economy. This is a significant time in our journey, and just a few thoughts. One, this is a marathon. This is not a sprint. We're in this for the long haul, and I think we have to get our mind set that way. I never ran a marathon, but a number of our children have. Alice and Pat, Mark, son-in-law Bill, son-in-law Nick. I may have missed somebody in the family. Anna did a half marathon, but all our kids, all 8 kids, were distance runners. And although my running career kind of ended in junior high, but in our family we're used to the long haul. We're used to the long distance. And I think really as Ohioans, we've got to think about this way. This is not something that we're going to get through. We're going to run through this quickly. That's just, much as we would like to, that's just not going to happen. Second, what we have to do these two things at once, keep us safe, get the economy back, is complicated. And what we have to do to fight back a bit against the virus is quite complex. The best practices in these businesses and these professions that we talked about today and all the other ones, that's very important. And that's important that everybody out there in business and profession follow what your peers have come up with as being the best practices so that we can ensure that our employees are safe and that we can ensure that customers are safe and that people have confidence that they can, in fact, go out. Next, there's still a lot we do not know about this virus. All you have to do is turn on the news, and watch that, listen to that, read about it. This is constantly changing what we know. We know a lot more today than we knew before when it started, but we still have a lot to learn. 4, as we open up the economy, let me just state the obvious and not shy away from it. The risk is up. The more contacts that we have, the more that we do, the more risk there is. That we can expect. We are now, we think, at about a 1-to-1 ratio, which simply means that on an average, one person who is infected with the virus in Ohio infects one other person. If we could get below that, then you start moving downward. We can expect that the opening up of this economy is going to take those numbers higher. But what we have to do is do everything in our power not to let those go very, very high. And a lot of this depends on what we do. So, What are the variables? What are the things that we're doing? Best practices for business, the best practice for professions. Men and women who've served on these groups have assured us of that. Second, testing. We've talked a lot about testing. We've not had enough testing. The testing is going up dramatically in Ohio, and it's not enough or not exactly where we want to be, but it's dramatically what it was higher than it was before. And this testing and the tracing is going to remain an integral part of what we do. And I want to give a shout out to our 113 health departments out there who are getting more people on board, hiring people, going to utilize this testing, utilize the tracing. And the tracing, as we've talked about, is probably as old as the Middle Ages, or maybe even before. It's not anything new. It is simply an opportunity to find out who is infected, then to go after that virus and stop that virus from moving from one host to another, from one person to another. It is all voluntary. It's a process that works, but it takes execution every single day. So the health departments out there and the men and women who are doing the tracing, thank you for what you're doing. You're on the offense for us. You're going after it. That testing, that tracing is very, very, very important. We're seeking it out. We're containing it. We're isolating it. And the final thing, though, is what we all have control over, and that is ourselves. We're entering a phase now in this where it's not so much about what I say, or it's not so much about what Dr. Acton said, or the Lieutenant Governor, and it's really never been that much about us because you all have done an absolutely amazing job. Coming here today, I looked at a new chart, interactive chart that was up, I believe, in the New York Times or the Washington Post, and it indicated, and I looked at how much distancing is occurring, and I compared Ohio to every state around us. And you all were doing better. We were doing better. Not by a lot, but we were doing better than every single state around us. So as we go through this from here, it's so very, very important, so very, very important for us to continue the social distancing. It is very, very important, when possible, to wear a mask. This is going to determine really whether we can do this or not. This is a gamble. This is a new part of the journey. We are on a road that's never been traveled before, certainly never been traveled before in Ohio. It is a road that has danger signs on it, and we need to fully understand that. And what is the danger? The danger is that we relax. The danger is that we pull back. The danger is that we say, okay, well, things are better. We don't have to do this. We don't have to pull back with that distance. And if we relax, if we pull back, if we take things for granted, in a month, 6 weeks from now, 7 weeks from now, things are not going to go the way we want them to go. We don't want to see a spike. We don't want to see that go up dramatically. We don't want to then have to make choices about, are we going to pull back in the economy? What are we going to do? What businessmen and women have told me, and I wholeheartedly agree, they were anxious to get started, but they said, once we're started, we don't want to have to pull back. We don't have to close the business again. And so what you and I do is going to determine our ability to get the economy moving, keep it moving, to be able to go out and do the things that we will be able to do, but all the while continue to be very, very careful. So it really is in our hands, and we want to really, really continue to do what what we have to do, and it will determine where this state really does in fact go. Let me speak now directly to those of you who are under 60, may not have any kind of medical problems. And let me just talk to you first, if I could. We look at the numbers for people your age, for people who don't have a medical problem. The death rate is small. The risk is not nearly as much as your friends who are older. But there are some things that we do know. People your age can get awfully sick. Don't die. Some die. But many times just get very sick. And those numbers don't show up in the deaths that Dr. Acton talks about every single day. You have it within your power not only to impact your family, but other people's families as well. Because while you may not be concerned about what happens to you, you may figure you're young, you're 20, 25, 30, and you're going to take the chance. You certainly can be a carrier, and sometimes you not even know that you are, in fact, a carrier. So again, being careful for others, wearing that mask for others, being careful that you're not bringing that back to your 80-year-old grandmother who is at great risk if she gets it. These are all things that we have to continue to remind ourselves. And it's easy to forget. It's easy for me to forget. It's easy for anyone else. Things are great out there today. It looks a beautiful day, at least in southwest Ohio and central Ohio. Spring is coming. Spring's here. Summer's coming. And things look good. But the virus is very much still out there. For those of you who are over 60, certainly for those of you who are over 70, the risk is high. The virus is still there. It is not gone away. And Dr. Acton can show you, and I know you've seen in the papers, the death rate as it goes up, as the age goes up. That's true with age. It's also true if you do in fact, have a medical problem. So, again, I would just remind you, as we open up the economy, there's more opportunities, things to do. Everybody wants to get out. But just be very careful. This too will pass. We're going to get through this. This is not forever. There's going to be ample opportunity to do the things that we all love to do, to see the grandkids. There's going to be ample opportunity when we're done with this, to take that trip, to live your life. And there's so many people, if you're 70 or 80 or 90, who care very much about you, who love you, and who want you to be around in years into the future as far as humanly possible. So please be careful for them. This is a good day. This is a day when we're opening things up. We have more opportunities. But I just want to caution us. This is high risk. This is a high-risk operation. But it would be high risk if we didn't do anything. It would be high risk for our state, for our country, if we sat back and said we can't do anything. So whatever we do is a risk. What I'd ask you to do in your individual lives and then collectively, because you have such an impact on everyone else, is make those calculated risks. Make those good judgments, because what you do is going to impact our ability to come back economically, but it's also going to really impact our ability to keep as many of our fellow Ohioans safe as we can. To my friends in rural Ohio, I live in rural Ohio. Fran and I live in Cedarville. In fact, we don't even live in Cedarville. We live out in a farm. So we understand that sometimes it feels like the virus is not impacting us as much. But we certainly see evidence that virus can come into the rural areas. We can see people who die, and we can see a movement of this. So we just all need to keep in mind that we are in this together. And if you're in a rural area, what happens in an urban area does in fact impact you, and may in fact impact you in the future. That your mom who is in a nursing home, that your dad who might be in a nursing home in that small county, if that virus gets into that nursing home, it's going to come in by somebody in that county or somebody in that community who might be working there. So we are all tied in together. And that's why we have taken the approach that we need to do this together. So a good day, a happy day as we move forward, but just a day that we have to continue to be exceedingly careful. I am optimistic. We can do this. We are Ohioans. We're going to get through this. I look forward to many, many days in the future as we continue to open up other things and as we continue to take care of each other. John?
Thank you, Governor. Very well said. I think that you covered it well, and I want to just say just a couple things. One, first of all, a little housekeeping item as it relates to cosmetology, personal services opening up, and restaurants. These will be posted. If they're not already up, they will soon be posted on our coronavirus website. And one thing, while personal services did discuss massage, those recommendations will come out of the medical board which regulates that particular industry. The good news in working with the cosmetology group, the personal services group, and the restaurant group is these are groups that are accustomed to being regulated. They all regularly interact with their departments of health. They have strict standards, and now they're going to have even more strict standards. As Governor alluded to, May is moving month. There are a lot of things that are moving in May in our economy. And I look back 2 months ago when we kind of all started with this and how much we've learned since then. We've just learned a lot, but we still don't know everything that we need to know. The learning will come every day, but I do believe that Ohio successfully led in and Ohio can successfully lead out, knowing that this will never quite be over until there is a vaccine developed. But as Governor noted, hospitals, we went away from essential, non-essential, manufacturing, construction, distribution is opening up. And on Monday, retail will fully open. I talked to our friends at Jobs Ohio last night. I asked them, once we get through May 12th, where will we be in terms of what will be open in Ohio's economy? And they said 89% of the economy will be open in Ohio on Monday. And once we add in personal care and the 50% occupancy rate for projecting 50% occupancy rate on restaurants, that will be at 92.5% of the Ohio economy, with obviously more to come. And so employers are going to be calling people back to work. At least some of them will be. And every single one of those businesses now has a stronger health requirement, a stronger safety requirement than it did just a few weeks ago when people come back. And businesses have embraced that because they know that you have to keep employees safe. You have to build consumer confidence. And I know that the businesses of our state understand that. And that's why these safety, it's where these safety provisions came from. We are learning to not just live with the coronavirus, but to live successfully with it in our lives. And as more of life opens up, I just want to reiterate what the governor said. We just have to be more vigilant about protecting each other, both personally vigilant and collectively vigilant, so that we don't see an increase of the spread of the virus, which certainly is a threat as we begin to open things up. The safety protocols that we've put in place, the testing, the tracing, they help isolate the virus and limit its spread. But we have to be also disciplined as we go forward so that we can keep creating economic opportunity while keeping people safe. Some things I want to emphasize from my conversations with the people in the personal care industry and restaurants. They all emphasized, the people in that group, they said, look, you have to make sure that these are strictly enforced. We don't want one bad actor to give our industry a bad name. And it's important that that happen. And it's not our opinion, it's their opinion as well. These things will be strictly enforced. And the regulations that were developed were that collaboration, that businesses believe they can live with them, and the health departments and the health officials that work with them believe that they provide the level of safety that we need. They're practical and safe. Trevor Weaver and Debbie Penzone did such a great job. And I know I did a call this morning quickly with John Barker, who's from the Ohio Restaurant Association, and he also reiterated to me that the members of his industry want there to be strict rules, and they want those rules to be enforced and violators to be held accountable. And the industry recognizes the need for that accountability, and the Ohio Restaurant Association put out a promise. They said that this is the restaurant promise, that they're going to make sure that they're protecting you and their employees, the customers and the people who work there. And I do, though, want to talk about the month of May just for a second, because, as I said, it's a moving month. Things are changing. And but we're gonna live with the coronavirus health consequences for a while. The economic consequences may last even longer. And even as over 90% of the economy will open up in this month, most businesses will not fully recover this year, and some of them may never recover. That's not because of anything that we're talking about here. That's because we're in the midst of a global pandemic and a global economic recession. If you read about what's happening in other continents, in other countries, they're experiencing dramatic economic consequences of what's happened with the coronavirus. But ultimately, this manifests in our lives with higher unemployment rates. We talked about this earlier this week, about how when people aren't working and they're not spending money, that affects our sales taxes and our income taxes, both at the state, local, and federal level, which is what we use to provide that vital safety net to people, to real-life consequences on health, education, and that social safety net. And so this is a time, as we're opening things up, that we have to pull together even closer, because it's a responsibility that we have to each other. We got to pull together, move forward, and really selflessly protect each other. I know we don't like masks, some of us. I don't like wearing them. I know many people that don't. But it's not about me. It's not about any one of us. It's about the responsibility we have to each other, to respect distances, to wash our hands a couple of extra times a day, to make sure that we're not spreading the virus potentially to someone else. Because when we do these things, that allows us to do the two things at once, to open up and to move forward. And we will continue to learn new things every day, and we will get better every day, individually and collectively. But this is the beginning of getting through this. We are getting through this. We are moving forward. We are smarter. We are better informed so that we are empowered to solve these problems in our own lives, in our families, and in our communities. And I love what the governor said earlier about Ohioans outpacing some of our other states. I hope you'll view it as a competition. Hope you'll view it as a competition that as we open up as a state, we want to continue to beat these other states. We want to show that Ohioans are personally responsible. They do care about each other, and that we will win the health side of this as well as the economic side of it. And I just thank all of you for what you're doing, and God bless us as we continue through this journey. Governor?